2, 3.
I've been battling endometriosis since I was 14. We obviously didn't know back then because, you know, quote unquote, having a bad period was such a normal thing. So being doubled over in pain a couple times a month and then, you know, progressively getting worse was just something that everybody dealt with, or so we thought, and you just kind of were quiet about it. You're kind of embarrassed about it.
I was diagnosed in 2011 with endometriosis. My symptoms started at about 12, when I would end up in AIG DuPont emergency room with severe period cramping and ovarian cysts. As I got older, I continued to have painful periods and ovarian cysts, but just brushed it off as being normal.
A lot of women in chronic pelvic pain, chronic pain, starting very young. When people do laparoscopies, they see nothing. But it's not like there's nothing there. It's tight, and how I explain it to my patients, it's like something has affected your skin, and it's me squeezing your skin all the time. And until I let go, or until I cut my hand away from your skin, your pain's not gonna go away.
In 1997, right after I had had my second daughter, I went in for emergency gallbladder surgery, and the surgeon then had told me, you know, you really ought to look into endometriosis specialist. You have it very bad. Yeah, I was 20 years old. I didn't know what that meant. And when I went to my regular gynecologist, she had just said, oh, I don't think you show the symptoms. You know, that doesn't warrant that. You just have irritable bowel syndrome. So, you know, who was I to question her? I just said, okay, and, you know, started treatment that way.
Finally, I decided to speak to my gynecologist about my symptoms. She brushed them off as well and told me that the pain was all in my head. At a family member's recommendation, I sought out a second opinion. My new gynecologist had me in surgery a week later, and there I was diagnosed with stage 3 endometriosis.
You know, I get a lot of people coming in and they've never heard of endometriosis. They're coming in with fertility challenges and other problems that are interfering with their reproductive health. But I can't tell you the countless number of people that have never heard of endometriosis or have vaguely heard of it.
So, you know, from that point on, you know, I've had a lot of surgeries. I've spent a lot of time in the hospital. Yeah, it's a pretty severe case. I'm sure my doctors and Rad, they know, but you know, I have to say, until I really came to Delaware and got a chance to come to Rad, I'd given up hope. The doctors couldn't help me. You know, the quality of life was kind of bad. And the best thing I ever did was run into a coworker that said, you know what, I think you should go to Reproductive Associates of Delaware. And it was just amazing from there. They've helped me a lot. They've, you know, done as much clamp surgery as they can do, and they've given me some great treatment plans that have kept me suppressed since then.
And over time, patients really did very well. And at some point, I'm like, wow, this is unbelievable. So a lot of your pain, and we really do need to write this up. I mean, the pain, irritable bowel, interstitial cystitis, lower back pain, anterior thigh pain, I feel like I'm sitting on something. All of that is endometriosis symptoms.
My goal this year in doing the EndoMarch is to raise awareness for endometriosis. I would like the younger generations to know that excruciating cramps are not normal. I would like to see the teaching of endometriosis in high school and colleges across the world.
We want to make a difference for the girls and females in our area. So we said, you know, what can I do? I don't want to see anybody else get to the severity where I'm at. And I said, what could have changed that? Education, early awareness. You can't change endometriosis, we don't have a cure, but we can change how severe it gets, and that's by making sure, you know, hey, if we put that education out there, I mean, all the way in middle school, high school, and then even college women, you know, hopefully they could detect it earlier and start a treatment plan and keep it from getting, you know, as severe as it is until we do find a cure.
Our center and everyone that works with us will commit our strongest efforts to treating endometriosis. 2015, we'll use all the best surgical and clinical and medical techniques, and we'll also recognize that things like kindness, compassion, and understanding will help.